Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, how the pandemic is changing the way government works. Beth Blower, the Associate Vice Provost for Public Sector Innovation at Johns Hopkins University, speaks with Dr. Josh Sharfstein about new approaches to providing city services that inspire workers and deliver results. She calls it the chutzpah of leadership. Let's listen.
Beth Blower, it is great to see you and to talk to you on Public Health on Call. I wanted to reach out because I've been hearing from a lot of people who work for government that it's a difficult time, that people don't trust them, that that they're exhausted. And I thought, why not check in with someone who works with governments all around the world doing interesting things? What do you see from your perspective?
Well, I think everybody is a little bit exhausted. I think that the sort of post-pandemic fatigue is real, but I think it's very real for people who work in government, particularly those that were on the front lines during the pandemic, that were required to respond to like an incredibly shifting environment in communities and across jurisdictions, having to do work in ways that they've never had to do work before in incredibly intense environments. And so I think saying that they're tired or fatigued is probably an understatement based on what we're seeing across the entire landscape of the public sector workforce.
Right, and you're not just talking about health departments.
No, I'm talking about those people that were still responsible for collecting trash, for keeping recreational opportunities outdoors open for you, for people that were social workers who are helping to shore up the social safety net where many people were job insecure or food insecure because of the shifting landscape. I think we really, forget about the fact that we have scores of public sector workforce that are continually delivering services into communities that are part of life-saving measures that the government provides in order to make sure that people are housed, people have access to core basic resources, and have education for kids. All of these things, are driven by an incredibly committed public sector workforce.
What can be done to help the public sector workforce?
Well, first, I think we have to address the fact that as many industries were dealing with the Great Resignation, government wasn't insulated from that. There were lots of people who left the workforce. There were also lots of people who have been burned out, so that are engaging in quiet quitting and some of the other things that we're observing. And a lot of that has to do with the fact that people were asked to do things that were far above and beyond the kind of core responsibilities that they signed up for. And now they're in a situation where it's not relenting. We're seeing, this huge investment in government because of the infrastructure investment or from ARPA funding. So program intensity has only increased. And we've got a burned out workforce. So it's kind of this perfect storm. But we are seeing some governments react and respond differently to it, trying to create some mechanisms for employee retention, for keeping people engaged in work that's very meaningful, that kind of anchors into the reasons why they joined government. But at the same time, we also are seeing a lot of knowledge loss and a lot of shifting workforce, which I think is going to be something that we're obviously keeping a close eye on.
Any place come to mind doing a particularly good job keeping the public health work and the public workforce together and engaged?
I think that there are lots of cities that have done a very good job at what I call kind of values alignment, where they are very explicit in the kinds of things that they're delivering. And I'll give you some examples. In places like Louisville, Kentucky, the mayor is always incredibly focused on outcomes. And you can talk to anyone that works in the city and they see themselves in a larger vision. So whether they're collecting trash, whether they're policing, whether they're engaging in in social work, whatever that is, they see themselves as part of this vision for being a more compassionate city, for being a city that's focused on achieving positive outcomes for its people. And it's because there is a very basic way that leadership engages and allows people to kind of plug into that mission. I think that, we're seeing some innovative ways that we're encouraging people to join the public sector workforce. So we're seeing for the first time some bonuses or some opportunity to get some additional training or skilling where people are joining the public sector workforce so they can get a certification in particular skills. Pittsburgh has done a really good job at expanding how they invest in their people. So they have a training core. And for those people that have joined government that are interested in deepening their skills in being a data analyst or in being able to do performance work, they have the opportunity to do that. Denver is another place where they've created essentially a whole entire center devoted, Peak Academy, to lifting the skills of the public sector. And people see that as an individual investment, and it does create a mechanism for keeping people much more satisfied in their work.
What about the work itself? How is government work changing as a result of the pandemic?
So there's a few different things that are happening. One, people saw that even in government, you can have flexibility on where work happens. And so the notion that everyone has to kind of cram into overcrowded offices and show up to work on fixed schedules was completely kind of blown out of the water during COVID. We asked people to work alternative schedules. People were working from home. This is a notion the space of work changed dramatically. And government was the last to the, to the understanding that you can get a tremendous amount of work done, even if it doesn't mean you're in a sort of traditional office setting. And so I think we're going to see more governments looking at hybrid schedules, looking at coverage that looks a little different than it looks now, which is actually a great incentive for working parents, for people who want to be more connected to their home life, but also want to be able to essentially contribute at high levels in the work. So we're going to see a shift in kind of how people work. And then I think we're going to see a shift also in teaming. For the first time in COVID, we saw public health expertise getting married to data expertise, getting married to service delivery in ways that weren't happening in robust ways at all prior to the pandemic. So all of a sudden, it was very important for our public health workforce to know where school facilities are, how to do dissemination, where people were, what were the conditions in particular communities. And I think that there was some of that work happening on the periphery, but for the first time, everyone was pushed into these sort of war room environments. And they realized you can rapidly deploy resources and actually make pretty significant public health gains by coordinating better with some of the other agencies across government, and especially those frontline agencies that are responsible for core infrastructure and service delivery. And so I think we're going to see a new kind of post-pandemic collaboration, hopefully, because we've learned essentially the kind of incredible value that having folks work side by side actually produces as it relates to getting good information and public health outcomes in community.
So they may have been working together to distribute food or to set up a vaccine clinic, but now they know each other, and different city agencies, different city employees can call on each other for a whole bunch of different issues.
That's right. But again, this, I think, is so rooted in leadership. And if leaders don't demand that this kind of collaboration continues, there is a pretty significant risk that, the toothpaste gets, there's an attempt to put the toothpaste back in the tube. I think that, I talk about it as sort of the chutzpah of leadership, and it requires like a pretty significant amount of leadership to force this collaboration to issues, but through issues, and also create the environment where we insist on deep collaboration across government.
In a sense, you're looking for leaders who are going to ask public employees to do more, even as they're exhausted, but more with support, perhaps, but still different, not just more, but different.
My personal story, I was a frontline worker in government for many, many years as a juvenile probation officer. And honestly, this is the kind of ask that I would have answered every day, because it was a huge gap. I was asked to make hard decisions in the lives of children and families. I didn't know if a social worker was involved in the child's life. I didn't know if there was food at home. I didn't know if there was housing, security. All of these things would have been incredible, and would have navigated decisions in much smarter and I think beneficial ways. And so I think we also have a fatigued frontline that is fatigued by business as usual service delivery. And these opportunities to work in collaboration with public health and other systems, I think are actually really attractive, particularly for those folks that are committed to this life of public work, but know that there are these real glaring gaps in the capacity of the system itself to actually solve some of the problems that they see every day.
So you used a phrase, the chutzpah of leadership. What does that require these days? If you are up in front of a room full of new mayors, telling them what they need to do to be successful in this environment you've been describing, what does it take?
It takes, first, clarity of vision. One of the biggest mistakes that I see new mayors and leaders make is they run on a platform, they come into government, go through a transition, they produce yet another kind of platform, then they start leading, and it looks a little bit different in leadership. And it gets confusing. And when you don't have like a sort of clear North Star with really succinct kind of distilled vision of what good or success will look like, it ends up creating a lot of confusion. And particularly in new administrations, that confusion seeds a lot of gaming, a lot of power, play, a lot of, just kind of resource grabbing. When you have leaders that come in and have the ability to, first, be deferential to subject matter expertise that exists in their government, and second, knows how to articulate a clear set of objectives that everyone feels very good about, including the people that live in the community or live in the city or live in the state, then you have the ability to very quickly deploy resources, a sort of rapid deployment of resources. And when you're able to do that with that kind of crisp clarity, it eliminates a lot of the noise that you see often when there's disclarity or where there, and also in disclarity, we see distrust. And I think in the early framing of this conversation, we talked about how kind of confusion or disorganization can also lead to distrust. And so I think the kind of chutzpah of leadership is really about how do you articulate what it is that you're trying to achieve in terms that are both measurable, that are, executable, and then that are also very clear and you maintain fidelity to them.
Well, Beth Blower, thank you so much for joining us, giving us this vision, giving us hope for all the government agencies we come into contact with and their leaders. We really appreciate it.
Thanks, Josh, for having me.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.